Welcome to the first Forecast Direct podcast of 2022. And we are really starting off well with our guest for today's podcast, Professor Emily Oster of Brown University. So let me just do a quick introduction, but welcome to UCLA, Emily.
Thank you.
So Emily is at Brown University. She's executive director of the COVID-19 School Data Hub, Royce Family Professor of Teaching Excellence, and Professor of Economics. She was educated both undergraduate and graduate at Harvard University, and has spent time at University of Chicago Booth School of Business before moving to Brown University. And so the millennials and Gen Ys who are watching this and are contemplating or actively involved in parenthood know Emily well because of the trilogy of Expecting Better, Crib Sheet, and The Family Firm, all about using data to make good decisions in parenting. Something that certainly when I was raising children was not around. If you haven't looked at these, I highly recommend them. Even if, like me, you're a boomer and you're done with child raising, you'll see lots of things in there that you'll recognize and will make you smile and go, oh yes, I understand that now. So let's just start by talking about that. So Emily, your fields of specialization are healthcare economics or health economics and statistical methodology in research. How did you move to working on issues of parenting, first of all, and secondly, translating what we do as economists in a way that that this next generation of millennials and Zs can easily understand and apply?
So I would say I really started on this this part of my career when I got pregnant. So this was Expecting Better in particular, which is the first book about pregnancy, was really driven by my own experiences and kind of by the experience of being an economist who was pregnant. And I entered that phase of life sort of thinking that I would apply a lot of the same tools that I applied to in my job, and that I would use data to think about the decisions. And I found a sort of landscape of decision making in pregnancy that was quite different and maybe sometimes less data friendly than I had hoped that it would be. And so my sort of beginning there was to say, okay, well, I need to collect some of this data and do some of this analysis to make the right decisions from my own pregnancy. And then it sort of moved into writing about it for a broader audience. And we can talk more about that transition, but I think the big thing for me is I've always been quite interested in the ways that we translate the things that we find in the academy, the sort of research we do, into sort of communicating it out to a broader audience. That has always been something that I like to do, that I think that I have, particular take on it that sometimes works. And so I sort of remember kind of doing this research for myself and then thinking about, okay, I actually could write about this for someone else. And that was the origin, at least, of the first book.
And it I wouldn't say it sometimes works. It definitely works. And I think is, an important contribution that we as economists can make is taking what we do in econ speak and translating it to something that others really can understand. But economics is all about the allocation of scarce resources, and anyone who's raised children knows that's all about the allocation of scarce resources. So why do you think it is that our profession has really ignored this part of economics for so long?
I mean, I think, if you sort of go back, there is a fair amount of what we call, household economics, right? So sort of studying the way that people allocate their labor time typically. And so, I think that that kind of overlaps with parenting, right? Even if you think about like Gary Becker's original, the sort of quantity quality trade-off, which when you explain it to a non-economist, they're like, what do you mean? You know, I want it. It's like, well, you know, we have this idea, but that's a very powerful set of models. The idea that, you know, that you would sort of have fewer children and want to invest more in them. And I think that that idea is like fundamentally rooted in the observation that your time is finite and your resources are finite. And you know, if you have fewer kids, you can kind of share the resources across more of them. In terms of sort of moving from the kind of generic, like how are we describing the way that the world is operating in the demographic transition, into the question of, you know, how can we use economics to help people organize their parenting better? You know, like I think that although I personally feel there are many tools from economics that are useful there, I think that it's been a little bit of a weirder transition, in part because it's kind of gendered, right? And economics has been like a pretty male dominated field. And I think that there is sometimes a feeling of like, well, that's like that's like for ladies. And it is only more recently that I think has become more acceptable.
Right. I mean, I think you brought up Gary Becker's work, and in a lot of that, it was really a comparison between market activity and non-market activity, as opposed to looking at non-market activity, the household and how that operates. And so that's an area that you're really pushing us into, and where I think the field belongs.
Yeah, I mean, I think there has definitely been there is more work in this space now within, you know, I don't think of the stuff that I'm doing as really in the academic space, but there is more work within the academic space about kind of how we understand the trade-offs people make, how we model, you know, the relationship between childbearing and you know, labor market choices, and how those things interact. So I think there's definitely a push in that direction. Right.
So let's turn to your more academic research. And you've done a lot of work in the area of sampling and how, you know, appropriate methodology for analysis, and in particular, some recent papers on observed and unobserved variables and how they bias the results and how they interpret the results. And I noticed in the family firm, you use that in the example about when does one start their child in school, at what age. Maybe you can talk a little bit about that research and how that informs us about how we make our decisions and how we interpret data.
Yeah, so I think that most of my, or like a huge share of my recent academic work, at least, has been really around the idea of kind of what do we learn from observational data, and how do we separate causality, you know, and correlation in some of these spaces. And I have to say, actually, there's a huge feedback between the kind of academic work and the non-academic work here for me, because prior to writing Expecting Better, my work was much more in the sort of health space. And my interest in talking about the statistical methods we use was actually like pretty influenced by the work that I was doing, the papers that I was reading in the service of writing about this public health literature and, you know, the context of pregnancy. So there's just a lot of these examples where you sort of dive in, and it's like, boy, we're seeing a lot of correlation, but it's not obvious we're learning about causality. So like a good example is we look at data on breastfeeding. You can see, like, is breastfeeding linked to child IQ? Well, that correlation is really strong. So it is definitely the case that being breastfed is correlated with having a higher IQ score on later tests. But when you look at what else is going on in the data, what you find is that the women who breastfeed that are educated, they themselves perform perform better on IQ tests. They tend to be richer. They're more likely to be married. There's all kinds of variables that correlate with breastfeeding that also independently we know to be associated with child achievement. So, you know, some of my, so that means that it's fairly important that you adjust for those and that you try to sort of think carefully about holding those constant. Some of my work is really just about how hard that is to do, and how in practice, it's very difficult to be confident that we are holding constant all of the things that are different across people, because it's one thing to control for someone's education or income, but it's another thing to be able to say, well, that's all the things that are different about them. And so in some of this statistical work, I talk about the issue of observables, which are the things you can see that might be impacting your estimates, and unobservables, which are the things that you can't see that might be impacting your estimates. And I talk about how you can, how researchers can make assumptions about the relationships between those things that would allow them to maybe make some additional progress, with the recognition that just in a lot of these settings, it's really, really hard to get around the sort of inherent problem of unobservable bias.
Yeah, I mean, that's really important because, in the discussion of the application of our research to policy, and not just in the kind of the frame that you work in, but more generally, thinking about causality, but also thinking about these unobservables, will really help us frame better policy.
I mean, I agree. I think we're often trying to sort of take our estimates and convert them to something where we're making either policy pronouncements or behavioral pronouncements or some other thing. When we're doing that, it really is pretty important to be clear on the causality, because the policies that we're making are about changing the policy, and that's only going to work to change the outcomes under the assumption that the policy and the outcomes are somehow causally linked. If in fact the reality is they're just correlated, there's no causality, then changes to that policy really aren't going to matter.
Right. So let's turn to some of your other research that has ended up in the public discourse, that of schools. So you wrote one paper, and I think it was in Nature Health, and that was on the transmission of disease, in particular COVID, by school children in schools that were open. And then you have another one on the impact of school closures. But let's go to the first one. And can you tell us what you found? And I think the results are kind of surprising, and not what not only people expect, but also not what they're saying.
Yeah, so I mean, I think to kind of step back, I've been working on this issue of schools and COVID really since, almost since the beginning, not quite, but almost since the beginning of the pandemic. And I think it's worth kind of thinking about why we ended up in the place that we did on this topic. So, in March of 2020, virtually all schools in the entire world, with the exception of Sweden, kind of closed for in-person learning. And I think there were a lot of good reasons for that. One was that we just kind of had no idea what was going on. And the other is that, school closures are commonly thought to be a pretty important or a potentially important mitigation factor in, for example, influenza, which is a disease that shows up a lot in kids, and where we think that, schools may be kind of centers of some spread. So schools closed, but then actually, as we kind of moved into the summer of 2020, many European countries in particular sort of started to reopen their schools, recognizing that one of the in some ways great gifts of COVID, even though in many ways it's just pretty much the worst, is it actually doesn't affect kids in terms of serious illness the way it does adults. And so in light of that, many places in Europe kind of opened their schools in the summer of 2020. And then, we came into the kind of fall of 2020 in the US, there's a fair amount of variation. So some schools were open, some schools were not open. It tended to line up on sort of political lines. So I started working on this on the data collection side. So I started working with a bunch of different partners, trying to collect different pieces of data about COVID cases in schools, data about which schools were open. And one of the pieces of that that sort of came out was around the question of whether schools were sources of spread. So whether there was a lot of spread in schools, which we could see, pretty clearly as of the fall of 2020, did not seem to be actually going on. And then the other piece was, okay, well, are schools a source of spread to the community? Is opening schools spreading COVID in the community? And what we find in that paper in Nature Medicine, using a nationwide sample of information on when schools were open and not open, and information on community case rates, we're able to see that in fact, opening schools with appropriate mitigation at the time did not seem to drive increases in case rates. So that was, I think, I think it is in line with much of what we are seeing, or virtually all of what we're seeing, which is that schools don't seem to be a significant source of COVID risk.
And then your other recent paper was on differentials in learning. Maybe you can tell us a bit about that as well.
Yeah, so then as we kind of moved through the end of last year, our team pivoted a little bit to trying to understand some of the consequences of the school closures. So if you look at sort of the map of kind of what happened across the U.S. in schooling over that sort of first pandemic school year, you see a huge amount of variation in opening, and the data that was sort of collected on that was not great. So we actually spent a lot of last summer working with individual states to kind of pull data together. But when you look at it, you see, for example, a lot of places in California were closed virtually the whole year, whereas a lot of places, say, in Wyoming, would pretty much open every day, regular in-person school for the entire school year. So just a huge amount of variation across the country. We merged that information together with information on test scores on sort of state standardized tests at the end of the school year. And we look at the relationship between whether the school was open for in-person learning and the test scores at the end of the year, in particular, the change from the last pre-pandemic year. And what we observe there is that in general, there are fairly significant losses in test scores, very significant declines in test scores from 2019 to 2021. But those declines are much larger in districts that were fully remote than districts that had in-person learning. So it looks like in general, the pandemic is decreasing test scores, particularly in math, but that's even more so true in districts that did not have in-person learning access.
And that was the reason why Mayor de Blasio said, regardless of disease transmission, I guess he didn't read your earlier paper, New York City schools are staying open, even though Detroit and Milwaukee and Chicago did close their schools up for a few weeks.
Yeah, I mean, I think Mayor Adams, so one of his sort of early pushes here has, he just came in office. Like, I think he pushed pretty hard for schools to stay open. And I think the reason for that is the sort of dual of these two factors, that on the one hand, we aren't seeing schools as a source of significant spread. On the other hand, we are seeing very large losses, not just for learning, but for learning, for mental health, for all kinds of other things. People are seeing sort of disruptions in school being bad for students. I think it's also worth noting that the students whose lives have been most disrupted by this do tend to be students who are low income, districts with larger populations of students of color. In our research on the losses here, we see not only are students in those districts less likely to have access to in-person schooling, but the losses associated with not having in-person schooling, the kind of downsides of virtual learning, are larger for those groups. So it's a sort of like double hit on kids with fewer resources, that they are both less likely to get to go to school, and it's harder for them if they are not getting to go to school. So I think that's really pushing a lot of policymakers in this direction of kind of schools really need to stay open.
So I'm interested in whether or not age matters. I know you have a recent editorial criticizing universities that have shut down, including my own. I'm here on campus today, but there are not many students around. Yeah. Some are in the dorm. So does age matter, or is this sort of ubiquitous across age groups?
So I think that when we looked in the fall of 2020, which was pre-vaccine, there was actually quite a big difference between universities and virtually all K-12. So there was just way more spread in universities. So we saw, if you kind of look at the map from some of those early months of fall of 2020, you can see like Penn State on the map in the case rates, because you can just see there's, and again, it's a low risk population, but we were seeing very high case rates. We didn't see that in school. So it does look like there's sort of something different about universities in that sort of fall of 2020 period. In the sort of current moment, this is what I was writing about in that op-ed. Most universities, yours being one of them, mine as well, have pretty strong vaccine mandates for students. They have been, vaccines have been widely available for a long time for community members. So I think that changes the landscape quite a lot. And I think there are losses to college students from not being in person. just like there are losses to kids in the K-12 space from not being in person. And I think in this space with the kind of availability of vaccines, there's just a lot of reason to keep things open.
Yeah, I've noticed a lot of difference in my teaching between teaching over Zoom and teaching in person. We came back in the fall and taught in person. I'd like to turn to another article of yours with a fascinating title. Does disease cause vaccination? And just as kind of an introduction, what I found interesting. So you're looking at whooping cough and across states and incidences of whooping cough, and that doesn't change the probability of getting it, right? But did end up changing vaccination rates. And one thing that I find fascinating, so California was one of the low vaccination states because we have pockets of folks who are opposed to vaccination and one of the high incidence rates. And it was surprising kind of your results. And do those, kind of reflect on whether or not COVID is going to increase vaccination rates? I mean, how do we interpret this?
Yeah, so what we find in that paper is that, we're kind of looking for something which is actually motivated by a story out of California. So there was a period in which there was a small, I don't know, like a medium-sized measles outbreak at Disneyland. And one of the things that sort of a bunch of people said in reaction to that was you sort of had these newspaper articles where people were like, oh, now I'm getting my kid vaccinated. And I sort of heard that as like, oh, I thought measles was imaginary. Like I didn't realize people got that. But now that I realize it's a real disease, I'm going to get my kid vaccinated. And so we wanted to kind of see whether that showed up in a more systematic way in whooping cough, where actually it's more like there are almost always cases, there are frequently cases in given years. And so we look at the county year level to see whether people seem to be sort of pushed into vaccination by the presence of cases in their county. In the sort of that, whether it's something it's not something that I can exactly like tease out of the data why you would see this relationship, which you do see in the data, but my sort of imagined idea for it was that that kind of this is because people realize that like whooping cough is a real thing, and they hear that their doctor says, well, did you know we like have a baby in the ICU with whooping cough right now? Like, don't you want to have your kid vaccinated? That seems like it's kind of disproven, or somehow the COVID situation must be more complicated because everybody has COVID, or at least everybody knows that it is something people are exposed to. And so if you thought that all that was required to encourage people to vaccinate was the realization that this is like a real, disease threat, you might have thought that they would already all be doing it. So there's clearly a bunch of other stuff going on in the case of COVID. I will say as sort of an addendum to the pertussis stuff and thinking about California in specific. So California, right, has quite low vaccination rates. And at some point after this measles outbreak, they changed the rules for school vaccine requirements. So it used to be pretty much if you just kind of said you didn't feel like it, you could not vaccinate your kid. And there was a bill passed that made it really difficult not to vaccinate your kid. It's like way more onerous now. And that has huge impacts on vaccine rates, like enormously bigger than anything we saw in our paper or people have seen in other interventions where they try to encourage people. So it seems like the kind of mandate part of this is probably pretty important, even in these kind of pretty resistant areas.
So the mandate would then be a substitute for a lack of information, right? On the individual level, it's costly to get the information, but the state public health authorities, maybe not so much.
Yeah, I mean, I don't know if you sort of substitute, it's a different approach, right? There's the kind of like help people, like I think as economists, we would like it to be the case that we can tell people, here's the truth, here's all the information here, like, and then let them make the right decision for themselves. In these cases where there's like some, compelling externality argument, it looks like just mandating is more effective.
But you don't expect the presence of Omicron to really change dramatically the vaccination rates because you don't have that information or demonstration effect that you
Yeah.
found in the paper, or?
I think there's some of that. So I will say, like, I was sort of in the, like a week or two ago, I was volunteering at a pediatric vaccination clinic. And there was definitely like this is months after first vaccines were available. There was definitely like a lot of people showing up for their first dose, sort of like seemingly somewhat on a whim, suggesting to me that something about the fact that like everyone in Rhode Island had COVID was sort of motivating that. On the flip side, there's clearly a fair amount of resistance in certain parts of the country to vaccines. And I doubt we're going to get, I doubt there will be high vaccination rates in those places. There are also places which are unlikely to mandate for kids.
So that brings us to the close of our time, but your work is incredibly fascinating, and it brings data to decision-making, which is important in this day of alternative facts.
Alternative facts, yes.
And,
I like to be only just the regular facts.
Yeah, regular facts and careful analysis and thinking about the difference between correlation and causality. So Emily, appreciate you taking the time to be with us today. And for our audience, go look at Emily's trilogy. And if not for you, for your children who are thinking about having children, it's fascinating, it's amusing, but it's also very factual. And I have to say that I thoroughly enjoyed it, and my millennial daughter turned me on to that trilogy. So thank you for being with us today here at UCLA. And so this concludes the first of our 2022 UCLA Anderson Forecast Direct podcasts.